live.
Yay.
Hi, everybody.
Hello, everybody.
Hello.
Welcome to Financial Freedom's webinar, and this one's on Medicare. And we'll show you why it's America's best healthcare plan. Today, our speakers will be me. I'm Chandran Rajaratnam, also called CR, if everybody wants to do that. We have our Vice President, Chief Operating Officer, Jason Harris, here with us, and Sammie Guajardo, Marketing Manager and Wealth Advisor as well. They are our Medicare experts, and whatever that means. I joke that if you're an expert, that means you used to be a pert and you're no longer one, but that's a silly joke and it makes no sense whatsoever. So, we're happy to have you here. Whether you're watching this live or watching the replay on our website, I'm glad you're with us. As you probably heard through the news and possibly some of the phone calls, if you're of the right age, people are calling you about the Medicare open enrollment. So this is timely. There's decisions some of you might have to make between now and the middle of December, and we hope to help you do that. And first of all, a little bit about financial freedom. We're a company that started at the turn of the century. That's this century, not the other one, right? If you're old enough, you know, turn of the century meant, 1901, but not quite there. I'm not old enough, honest. I brand new. I'm just brand new. But we're a comprehensive wealth management planning firm, and we're committed to help our clients improve long-term success, and we call pursue financial freedom. Our commitment is to care deeply about you and also your financial life. And I put that emphasis that way because oftentimes, and actually more often than not, we love partnering with our clients as they get into retirement, as they move through that process of after retirement into the legacy phase of their lives. We're helping them with as much as possible. For example, we're not Medicare providers or insurance companies, but we know enough that this is important for our clientele that we will be up to date in our knowledge and help people go through that. Social Security is another one that we help people with, right? So our commitment is to care deeply about you and your financial life. At this point, let me show you our team. As you can tell, the one criteria is, except for me, that you wear blue when you take a picture. Actually, my wife, Holly, doesn't have blue. Does she have a black jacket on? So, and we're all good looking, which is one critical thing for, if you're ever looking for a financial advisor, make sure they're good looking people because they clearly know more than everybody else. But, joking aside, we have a team that's dedicated to you, our clients. And if you're not a client yet, please become one, because you'll see that you'll never regret that decision. You'll actually cherish that decision because we'll cherish you as well. But anybody in the team is willing to help. We are one team. We don't have separate financial advisors with their own ideas. We have collective wisdom that creates what we do and the things we provide to our clients. And every client is unique, so it'll be your financial plan, not a financial plan. So welcome aboard. All right, Medicare. I'm going to turn it over to Jason and Sammie to tell you all about the ins and outs. I'll stay on because I'm probably the only person, yes, I am. I'm the only person in the company that's been on Medicare, and have been on for 9 years, which tells you I must be 44 by now. But on that note, Jason, tell us about Medicare.
Great. Yes, thank you, Chandran. Glad to have you here as well. And it's certainly a treat to know that you've been through this road and this experience. So we get to share and learn from all that you've gone through with Medicare. So it can be easily summarized as A, B, C, D, except we don't usually see the D come into play. So as we were looking for graphics, of course, you only get the ABCs. So it's a little bit more complex, Medicare is, so we add the D in there. And we're going to talk through all the ins and outs of this, including Part D. So we'll go through all those. Let's start with a little history, though, of Medicare It was established in 1966 by the Social Security Administration. It is now run by the Center for Medicare and Medicaid Services, which is all part of the Department of Human and Health Services. And it's for, a lot of people think of it as just for people that are over 65, but there are also younger people with disabilities, ALS, people with the end-stage renal disease. Those are all people that would qualify for Medicare. And over 65 million people are currently covered in the plan. 52 million of those are those that are over 65. So again, it's the majority of it is over 65, but then there are others. And then it does cover more than 50% of medical costs. Now, we did say this is America's best plan, so why is it only half of the coverage? Well, private insurance helps pick up the rest, and we'll also talk a little bit more into why there's that difference there. Okay, so when can you get it? Well, as we talked about, 65, or also when you leave a company-sponsored plan. So for example, if you're 67 and then you retire, well, you would have all the rights to get into the plan without a bunch of underwriting and all that stuff, as if you had just turned 65. So that's a nice benefit there. And you're first eligible 3 months before you turn 65, the month of your 65th birthday, and 3 months after. So you do have a 7-month window to sign up. A lot of us want to rush and get signed up on the 3 months before, but you do have a nice window there to look through all your options. And of course, all the mail you've been getting, you can have a way to have time to sift through all of that. Also, if someone is on disability at 60, they can also get Medicare. So that's another provision there. Okay, and so what does it cover? So most expenses, and underline the word most there, most expenses are covered for hospital, medical treatment, and prescription drugs under the plan. But there's lots of gaps, lots of holes in here. You can see your out-of-pocket expenses. You've got the premiums, the deductibles, co-insurance, dental care, also vision care, eyeglasses, that's not included. Now, vision care would be covered if you had like a medical injury. That would fall into the medical provision from above. But yeah, if it's just kind of basic eye care, not going to happen. And then there's also charges, you see long-term care charges above Medicare approved amounts. So facilities can charge up to 115%. So essentially a premium above that, well, it would not be covered under the basic program. So don't worry, we're going to get to the good stuff soon, but we want to walk you through all these A, B, C's, and D's, okay? So Sammie, why don't you tell us a little bit about this Part A?
Great, Jason, thank you. So Part A is all about the hospital. I like to think of it as, so this Part A is the first thing that you see, the first thing that you would do when you have an illness or an injury is you rush to the hospital. So that is Part A. And what is covered is inpatient hospital stays, inpatient skilled nursing facility care, and a side note, not for custodial or long-term care, remember that. It also includes home health services for part-time care and hospice care. So these are all the things that are included, and we'll get into the details of how they can be included. So your coverage requirements for Part A, hospital stay. So the doctor has to prescribe it and the hospital agrees. Now, what does that mean? That means that you actually have to be admitted to the hospital for Medicare to start kicking in. And you may rush to the emergency room or urgent care, or you may even go to your doctor in your outpatient clinic. None of those count until they say you're officially admitted into the hospital. So that's kind of the key phrase that you want to make sure that you that you ask about or that they tell you whenever you go to the hospital. And then skilled nursing facilities, the doctor has to certify again. And then another piece of that is you have to have a 3-day hospital stay. So, an example of this, again, to keep in mind is that when you get to the hospital, just like we said, you have to be admitted. That's actually your admitted day, okay? That's not day 1, that's just your admitted day. And then you will spend 1 full day into the hospital, spend the 2nd full day, spend the 3rd full day, and then the 4th day is your release day. So it's actually 5 days if you think about it, because they don't count the admitted day or the release day. They count those 3 in the middle. So really make sure that you are looking out for when you get admitted to the hospital, whether it's 9 p.m. at night, 1 a.m., those things really matter. So that is to get into a skilled nursing facility. And then you have up to 100 days into a skilled nursing facility. And then lastly, hospice care is something that the doctor has to certify that you have 6 months or less to live. So these are all the requirements for coverage. And then let's get into all the little details about money, the money piece of it. So you can see here that just like Jason said, if you work 40 quarters, it's essentially free. So that's at $0 if you've paid into the Medicare taxes. Now, if you haven't worked 40 quarters, you do have some hope. You can get Medicare Part A for the most part. You might want to check some things, but if you have only worked 30 quarters, you would just have to pay a premium for Part A. And then less than 30 quarters, you would also have to pay a little bit higher, $506 a month premium. So make sure that you look into that. Even if you haven't worked 40 quarters, you could still get it. The deductible piece of this, so you're paying your premiums every month, you go to the hospital and your deductible is $1,600 for a benefit period. So a benefit period is 60 days long, and a new benefit period starts on day 61. So what this means is that whenever you go to the hospital, you get admitted, we talked about all that, and then you're in the hospital, you're staying there, you can stay up, in the hospital for that full 60 days, or maybe you get better on day 15 and you go home and then you have a setback and you're like, man, I got to go to the hospital again. So then you go back to the hospital on day 25, and on day 25, it's still that benefit period within the 60 days. You don't have to pay that deductible again. So it's really good to know, like if you're on day 55 and you're like, I'm kind of feeling something, just go to the hospital and, get it checked out. That's what we would recommend. And then going down to your coinsurance. So again, coinsurance, it's something that we're familiar with medical insurance. So $0 if you're in the hospital day 1 through 60, you still pay that deductible, but the daily cost is $0. Then it starts jumping up. So $400 a day for day 61 through 90, $800 a day from days 91 and beyond. And you even have a once in a lifetime 60-day extension on that. So good to know that that's there. And then you have 100% after 150 days. So let's think about this a little bit. Say you're paying $400 a day for that day 61 through 90, that's $12,000. Okay, that's coming out of your pocket. And then let's look at, maybe you're staying longer, 91 days, through 150 days. That's almost, I think it was $48,000. Okay, that's coming out of your pocket. So again, you might be thinking, why is Medicare the best plan, or America's best healthcare plan? We have some answers for you, and there's actually things that can really help reduce these costs that we're going to get into. And then lastly, skilled nursing co-pays. You can see there, day 1 through 20 and all of those. And I'm going to pass it over to Jason to go ahead and talk about Part B.
So now we can finally see a doctor. Is this how it
right.
works? Part B is so we can see the doctor. So all that was just to get into the facility. So yeah, Part B is very important. You definitely need the second half of Medicare here. And here's what's covered. The doctor's services, your annual wellness check, emergency room, outpatient pieces here, labs, all this stuff, medical services. So you can kind of read the list there. I always like to look at what's not covered. So let's look at the next list here. Some of your doctor's services. Again, we're back to the dental and the vision, routine foot care. So be careful if you've got routine foot care, chiropractic, not going to happen under just Part B here. Outpatient, what's not covered, cosmetic surgery, that one makes sense. But if you have a non-emergency need outside of the US, not going to work. What they'll have to do is just put a big Band-Aid on you and ship you back over here, okay? So just be aware of that. And then other medical services, so prescriptions, we'll get to more of that soon. Again, long-term and custodial care is not covered. Okay, so for 2023, here are going to be your costs monthly. The premium has actually gone down by a little over $5 here per month, which is great. This is the first time that this has happened. And what this is showing is that there's enough reserve that they can and actually do lower the premium cost here inside the plan. So while everything else is going up, it's nice to see this one actually going down. So that's a great benefit to us. And then even the deductible's gone down by $7 there. Okay, so also the co-insurance there. So there's the 20%, that's remained unchanged, but that means Medicare picks up that 80%. So you're really paying just the 20. Although as we were looking at those numbers, Sammie, this could get a little bit expensive. You know, it's still 20% of a big number is still a really big number.
Yes.
So for now, why don't we skip Part C? And also, by the way, I forgot to mention earlier, if you guys have any questions as we're walking through this, we'll save them to the end, but feel free to type them in the Q&A and we will make sure to get to those. But let's skip Part C and go to Part D here.
Yes, so Part D stands for drugs, okay? Prescription drugs, an easy way to remember that. And just like we had talked about big numbers, here's a few numbers to go through as well. And our little donut hole at the at the bottom there that you might see, we'll get into that as well. So the premium cost for prescription drugs has also gone down just a smidge. Okay, we still like seeing that going down, so that's good. So that's your premium cost. Now, I do want to say not every plan covers prescription drugs. So you really want to make sure, and it'll vary. Some have different numbers for copays, things like that. So I want you to know that Part D is not just a blanket like Part A is. It really is, it varies by plan. So, but your premium, $32.74 if you have that, and then deductible, this is where it really varies. So some plans have no deductible at all, and some plans have, it can only go as high as $505 in 2023 for your deductible. Now, after that deductible is reached, then you go into the next stage, which is the initial stage or the co-insurance stage. So for this stage, you would be paying, again, varies by plan, but whatever your co-insurance piece is, whether it's 20% or $20, they all vary. But that initial stage is from after your deductible, so $505, all the way up to $4,660. And you are in that initial stage for that entire year if you stay within there in that range. Now, the donut hole stage is a little bit more complex. So whenever you're paying your prescription drugs, for example, say you have to get insulin and you pay $30 for that, and then your insurance pays $370 for it. So that would be a total of $400. And that total actually goes towards that your total cost. So that $505 through the $4,660, your whole prescription goes towards that, which then will go towards the donut hole. So you want to make sure that you're looking out for that. It's not just what you pay, it's not just what the insurance pays. Now, the good piece about that is that it may get you to the donut hole quickly, but it also can get you out of the donut hole quickly because it's the same piece. So that whole prescription cost. Now, what is the donut hole? I know you're mesmerized by the pink donut in the corner, but let me talk about it a little bit more. So between
Sammie, I prefer glazed.
Sorry, I was making the slides and the pink sprinkles really spoke to me.
I guess if whoever makes the slide gets to put the donut in. I got you.
That's
All
right. Yeah, so for the donut hole, so that 4,660, between that and 7,400, you are in the donut hole. And that means that you're not paying the copay that's stated on your insurance. It actually switches to where you pay 25%. And that is for, it's eliminated for generic, so it's brand name drugs, okay? Now, just like I said, you pay $30 for insulin, your insurance pays $370. You know, you may pay a little bit more or less, or probably more now that you have to pay that 25%, but still that whole 400 goes towards getting you out of the donut hole as well. So again, very important to remember that. So then you're in the donut hole, and then now you're out of the donut hole. And this is all within a year, okay? So if you're out of the donut hole, you go into the catastrophic coverage. And that is where anything over 7,400, you only pay 5%. And I know as Chandran has told me before, it's when you're totally broke, they'll give you a break now with giving you 5%. So that is part D. And I want to make sure, you know, with all that we talked about, if you do have any questions, just like Jason said, please put it in the comments. And also, Chandran, if you have any thoughts on this piece as well, I know the prescription drugs can be a very sticky subject.
Yes, Sammie, actually, I know you covered it well, but the one thing I would tell you is I'm back on the premium. That is, you know, there's an estimate on the average, but you can get more expensive premiums and also less expensive. But the difference is as follows. Each company has what they call a formulary. It's a huge thick book of every drug that they cover and whether they call it a generic or a non-generic or a brand name drug. And sometimes you may find your prescription is covered under these three plans, but not under the other three. So you want to be able to switch and move to one that covers it. Now, you don't want to go through that 500-page book, but whoever is your Medicare specialist, you know, for your insurance, would be able to do that. And we'll talk about that at the end.
Yeah, that's a great note.
And there were a couple questions too. The premium shown here, that is a monthly cost. So that, so you know that. And then also co-insurance is the same as copay. Yeah.
Good questions. Those are great. All right, who's ready for part C?
I am.
All right, let's get into it.
Well, I mean, as we can see here, these costs can add up pretty substantially. There's lots of things that the basic plan for Medicare doesn't cover. So let's look for some ways to actually cover these costs. So you can draw a line down the middle of this screen here. So you can do the original Medicare on the left side here, which is the part A and B, and then you would add the supplements, supplemental insurance you can see there. It is standardized benefits, and that there's that private insurance. It has to be approved, so not anyone can just say, hey, here's a Medicare plan. No, it's got to be approved by Medicare before it can be offered. And there's only a limited number of plans, and there's only 10 available, and now 2 of them are closed. So there's really only 8 available that you could be put in. So it's a lot more standardized. You don't have to do a lot of guesswork, and we can get into more details on that here shortly. But then the other option is on the right-hand side, which I'm finally getting to it. So Medicare Advantage is what is known as Part C. So it includes that Part A and B benefit. You still have to pay for that Part B, but it's just all wrapped up into one. You just have one, like we're used to, one insurance card that you would present to the doctor. And it could include Part D if that's part of it, and then they'll wrap additional benefits into it. So let's talk about this right side first, the Part C, which also knows Medicare Advantage. It really is a cost-effective alternative to the original Medicare. And think of it, it's very similar to what we're used to. If you're in a corporate plan, you would, be able to go see certain doctors. You might have a provider network, so we're familiar. Okay, I can only see these certain doctors in this certain region. So very specific in those terms. But if we think about how insurance usually works in our minds, it's probably pretty similar. You usually do have co-pays that you'll have to do. What's nice on the right-hand side, it converts that $1,600, it was the Part A deductible. It'll actually spread that out over, per day. Let's say, you only have to pay $200 a day instead of the full $1,600 up front. Most hospital stays are usually around 3 days. So, it could save you a lot just in that piece right there. Then there's also low or no premiums and deductibles. Some are actually zero. So you would not pay anything additional for that piece of it just to have it. So that's kind of nice. Some of our, veterans who are on the TRICARE can utilize this as a supplemental thing if they want to go get help right away or don't want to travel as very far. It's a nice way to do that because it's really no upfront cost, then get your help from the VA later. So that's another way to do it. Lower co-insurance, a lot of times vision and dental will be included into that, which is huge. I mean, that's the one thing that it's like, okay, where am I going to get that vision and dental care? You can get it in the Part C. And again, we talked about prescription drug coverage. Okay, so that's one way to do it. Let's talk then about our other option, which was the supplements, or Medigap is another way you might hear that explained. So this generally offers better coverage for you, but there is a premium that's probably going to be a little bit higher. Now, I'm going to let you know that premium should more than outweigh the cost when you kind of look at the broad scope of things, and I'll explain that in a little bit. But here's more of the costs that are covered. Again, you got several choices. This is nice, no provider networks. So let's say you're on a trip in Florida or somewhere else and you need help. Anywhere that's offering Medicare accepted there, you will be seen and it'll all be part of the coverage plan. So you don't have these weird out of network kind of situations. No specialist referral. So a lot of times, something else happened with me, I've got to get a specialist, someone got to sign off on it. That's not part of this plan. And then all the plans pay for that Part A copay. You've got 365 additional days of hospital coverage. And then also Part B copay and coinsurance is paid for. Hospice care coinsurance is paid for. I mean, this is looking good. Then there's also certain plans on the right side here that will pay for the skilled nursing coinsurance, your deductibles, and again, that excess charges comes up again there, foreign travel, emergency care. So yeah, a lot of times these premiums, it's more in like the $200 a month range. But if you think about it, if all these things are covered, then it can be a good benefit for you.
That's huge. Big thing.
Yeah. Now I do want to show you this chart that lines out the differences of all these plans. I know it's a little bit confusing, but the nice thing is we circled the one that we would recommend you look into and go with is that Plan G. And the reason there is because every box is checked except one. which is the Medicare Part B deductible. So, and that deductible, remember, was $226 for the year. So if you go to the doctor one time and it will cost you about $226, everything else will be covered. And if you're like some people, you may not go to the doctor just once. You may have another checkup. You may have another thing that happens. Each time you go that year, there's no extra cost. So it is a very nice, robust plan. And if you add up those, you know, the premium that you pay each month, you're probably going to get a really good benefit looking at that. What the other huge benefit is, again, you have the freedom to go where you'd like to go. So for example, if you want to see some of the top doctors out there, usually they're going to charge that excess, that 115%. Well, you would have the same access that you would have with just this one little deductible that you pay for the year. The other nice thing is with these supplements, you can, when you enroll, get into it, because there wouldn't be another, you don't have to do any underwriting or anything else, versus if you waited and said, okay, I think I need this plan G. Well, you're gonna have to go through a bunch of underwriting processes, and that's not very fun. This one you can get in, no questions asked. Then you can always downgrade to the Medicare Advantage if you want to go that route for each open enrollment. So each year you have that choice to do that.
Yeah.
So on this last slide here, it just kind of gives a summary, covers all the gaps for Plan G, except that deductible. You've got Part A deductible, co-insurance, skilled nursing, all covered, excess charge, all covered.
Yeah.
Jason, if you can go back, or Sammie, go back to that previous chart for a second. I just want to let you know that I was on plan, one more chart back. If you notice, there's an F and FH, right? That that was available until a couple of years ago, and people are grandfathered into F and FH. If you notice, compared to G, the only difference is it pays for the Part B deductible, which is $226, right? And but I switched to G because, and I was grandfathered in because the savings is over $100 a month for switching from F to G, and all I had to do is pay $226 a year to get that benefit.
Yeah.
The other thing is that even though the premiums in the 200, 250, it'll go up slightly, but so will everything else. It's still very inexpensive if you add up the Part B, you know, the monthly premium you got to pay plus this fee. But because you got no other charges, at the end of the year, in my estimation, you will save money. I've saved money by being on it. I had a serious medical issue 3 years ago, and I was in the hospital for 10 days. And then, unfortunately, I caught an infection. It took me 2 months to go to, you know, I carried a bag of antibiotics every day, refilled every day for 2 months. I saw 2 bills go by me, meaning they just told me that people charge. One was for $99,999.99. And the next one was for $900,999. I said, oh, it's a duplicate. No, it wasn't. It wasn't a duplicate. So there was over 200,000. There were lots of other little bills of cost that if I had to pay 20%, that would have been a $40,000 bill for me or more. I paid $200 for that whole 5-month stay. And that's only because the hospital wouldn't let me bring my prescriptions in, my cholesterol, you know, blood pressure, all that stuff. I had to get it from the hospital pharmacy and pay their price. So, but I don't complain about that. So and as you said, Jason, the more critical thing is there are no questions being asked at the time you turn 65 or at the time you're eligible for Medicare. You can get this with no questions, no medical issue. In future years, Medicare Part C, you can switch with no questions anytime for the Advantage, but you cannot do that for the supplement, right? You have to go through relatively mild underwriting, but still underwriting. So if you are sick or something's happened, then you may not be able to get this, what I think is the best plan.
Yeah, well said. Thank you, Chandran.
So anytime anybody wants to, you can text me and find out, okay, what is it like to be on Medicare? I can tell you. Even though I'm only 49.
Right.
One of those,
Right.
yeah.
I do. So we're going to talk about next steps. I do see some questions coming in. We'll get to those at the very end. Just got to go through these last couple slides and then we will pop over to those. So also, if you have a question, please drop those in there and we'll get to those. So next steps, you have listened to the webinar, check. What's your next step? Well, if you have questions that are more personalized that you want to talk with us today about or in the future about, please text CARE. So it's right on the screen there to 458-777-4458. That will actually text you a link to schedule it says financial review, but it's a Medicare review. So that way we can go over it for anyone who is a client of ours, of course, and anyone who is not. So we would love to go over those options with you. And then a little bit about LPL Financial. They are our broker dealer. And one big piece to remember about them is they're the largest independent broker dealer, no proprietary products. That's why we love them and work with them. And lastly, we have a few disclosures and, skim through those. We'll leave it on the slide here for just a few seconds.
Yeah, I've just got to, hold on, I just got to the seventh line.
Oh, no.
Seventh line. Oh, okay.
Got it?
There it is. Okay. All right, I got it. I read it.
Oh, perfect. Sorry, I should have waited a little bit longer.
Yeah, I'm a little slow reader, so it's okay.
Wonderful. Okay, so questions. I see we have those in the box. Jason, you want to read some out?
Yeah, we do have a couple asking for the slides or will be available for a download. And we will send out the replay. So since you guys were all on the call or you had signed up for it, you will get the replay showing everything, including our wonderful voices on there.
That's right. And we will have it. You can share that email or that replay. It'll be sent through an email. So you can share it with anyone, or it will be also living on our website and our YouTube channel. So there's a lot of different ways to view this recording again.
Okay, and then does Plan G include dental, optical, and prescriptions?
No, it doesn't. So that's on the supplement side. None of the supplements include dental or prescriptions. You have to go get a Plan D for at $30 a month or whatever it would cost in addition to that.
And then someone wants to know the Plan G monthly premium.
Well, that varies from when you start your age, and the premium is set by Medicare for and the private company for all of the people of that age. So when you start at 65, the last couple of quotes I've seen through one of our financial clients who've gone, we have a company that we've sent some people to that have done a very good job of providing the options. It seems to be in the $200, $220 range to start with. And maybe when you're 74, mine's in the low 300 range, right? So that's, to me, that's still very affordable for the benefits I get. Say, all doctor visits, all specialists. But I go to a specialist 4 times a year, and that would have been a very expensive visit. Lots of ultrasounds, things like that. So,
yeah. Okay, a couple more here. If someone starts getting their Social Security check when they turn 62, are they also eligible to go on Medicare at 62?
no, they're not. They'll deduct the Part B when you turn 65 or delay it until you finish working and switch. But no, you can't happen. If you elect me king, I will make sure Medicare goes down to 55 because it's probably, I don't know why the politicians don't do that. It actually will increase the productivity of the country, but you could talk to me about that offline. But Medicare should be down to when people want to retire and get off their corporate plan. Too many people keep working, even though they don't want to, because the cost of healthcare until you're 65 is almost prohibitive these days, right?
Yeah.
Chandran for king. I like that. That's a nice ring. to it.
Raja in my name actually stands for king. So apparently
Ah.
3,000 years ago, somebody in my family was a king. I don't know king of what, but you know.
Nice. Okay, we have one more here. Is Medicare always primary even when there is a company provided insurance?
The Part A is primary. Very rarely does a company provided insurance, override the hospital benefits of Part A. Since you don't have to get Part B, then anything else can be primary after that. A is automatic, but B isn't. So
Fantastic. I think we answered all of our questions. We'll sit here for maybe another few seconds just in case one pops in. But I think we've got them all down. Thank you everyone for joining us. This
thank
is
you.
Great presentation, a great conversation, a lot of great questions as well.
Yes.
Great. All right, everybody be well. And be careful, it's dangerous out there.
Bye.
Bye.